Hello, welcome to our Clinical Teaching on the Run series for clinicians. I am Dr. Leslie Ann Sadownik, and I will be walking you through this online presentation. This presentation, Time-Saving Tips, is part of a series of 6 presentations that cover the essential teaching principles and skills for clinical teachers. Welcome to Session 2. In our last session, I introduced 4 key steps to becoming an effective clinical teacher. The first step was to inspire learners. The second key step, and the focus of today's presentation, is to involve learners in patients' care. Step number 3 is to teach learners how to think. And finally, step number 4 is to aim to improve a learner's clinical skills and/or performance. In this session, I will discuss how to integrate a learner into your clinical setting and manage your time. You can involve learners efficiently by teaching strategically. Strategic teaching involves taking an interest in your learner, preparing the learner for the patient and vice versa, and teaching around the patient's problem. One of the characteristics of excellent clinical teachers is that they take a genuine interest in their learners. Why is this important? It is tempting to jump right in with your learner and immediately start seeing patients. After all, you may have a long list of patients to see. However, taking time at the beginning of a clinic or call shift to establish a collegial relationship with the learner is important. This relationship will be the foundation for strategic and individualized teaching. Try and get to know the individual in the white coat. Try simple questions like, where did you go to medical school? Or what did you study before medicine? What do you do outside of medicine? If you do ask these questions, you will distinguish yourself from the majority of clinical teachers who do not ask learners anything beyond their name and stage of training. One way to break the ice is to begin by telling the learner a little bit about yourself. Describe how long you've been in practice, the type of practice you have, how your practice has changed over time. Describe what your typical day and/or work week looks like, and what you like about your practice. Learners, especially residents, are looking for role models. They may be interested in your perspective about why you chose your field of practice, how to set up and run a practice, or how to balance work and personal life. In order to teach strategically, you need to diagnose the learner's educational needs. Don't assume you know what the learner needs. Every learner is different. Take an educational history in order to diagnose the learner's need. Explore their background. What knowledge does the learner bring to the clinical setting? What attitudes or beliefs may affect their clinical experience in your area? For example, if you're working in an area that is socially sensitive, like addiction medicine, palliative care, and/or sexual medicine, you may want to explore what the learner feels about these areas of medicine. The educational goal in these settings might be exposing the learner to how attitudes in its society can affect individual health, or even how their own attitudes may affect individual patient care. Next, it is worthwhile asking about previous clinical experiences. Are they at the beginning or end of their rotation? What have they had the opportunity to see or do? Is there anything they feel they've missed out on so far in their training? Ask about their clinical skills. Have they had the opportunity to perform a particular skill? And if so, how comfortable do they feel with their skill level? Are there any aspects of that skill that are challenging? For learners whom you work with on a regular basis, try asking about recent challenging clinical experiences. Have you seen any interesting cases lately? Again, for learners whom you work with on a regular basis, try and get beyond social small talk. See if there's an opportunity in the clinic to reinforce learning that has recently taken place. You can ask about what they are studying at home, what topic was covered in their last academic half day, or what topic was covered in their last grand rounds they attended. The educational history should clarify what teaching or learning goals are appropriate for that learner. Of course, you can try asking them if they have any specific goals or expectations for the clinic. However, this inquiry often evokes a blank stare from the learner. Instead, try asking about their needs in different ways, such as, is there something you've not seen that you would like to? Is there something you've not had the opportunity to do that you would like to? For example, I remember a medical school student who told me that they had not yet had the opportunity to do a speculum exam. Now, this was the student's last day on gynecology. Well, our goal for the gynae clinic became very simple, yet achievable. The educational goals for the day should be within the learner's zone of proximal development. The zone of proximal development is the difference between what a learner can do without help and what he or she can do with help. This is the zone where the learner steps beyond what they can comfortably do into an area where they are challenged but not overwhelmed. Identifying this area and teaching at this level is the key to effective teaching. Of course, when you push students into this area, they need to know that you are there to support them. While this zone may be different for each learner, there are some core competencies that one can expect given the stage of training of the learner. For example, if a medical student is just starting their clinical rotation, it is reasonable to expect that they can collect and report patient data in an organized and clear manner. But later on in training, for example, a first-year resident, I would expect the resident not only to present a clear history, but to also analyze the data and generate a differential diagnosis without prompting. At a senior level, I would expect a working diagnosis followed by management recommendation. You will need to outline how the learner can ask for help if they are struggling, and what you will say or do if you are uncomfortable watching the learner struggle. Best to do this before the patient encounter. For example, when I'm teaching medical students how to perform a pap smear, I will let them know that if they get to a point where they are struggling, they are to say out loud, Dr. Sadownik. This will alert me to the fact that they need help and or guidance, and I will try and provide some instruction on how they can go further. Also, if I'm uncomfortable with what they are doing, I often put my hand on their shoulder and they know this is a signal to stop what they are doing and let me give them some instructions on how to adjust what they are doing. The key is to be able to observe the learner up to the point that they cannot perform the skill, resist the temptation of taking over, but step in and provide guidance so that they can go one step further. So now that we've taken an educational history and defined some reasonable educational goals for the learner, let's discuss how to prepare an educational plan for the learner. Basically, in order to prime the learner, you need to outline a job description, prepare the patient for the learner and prime the learner for the patient, and focus the learner on the specific task or problem for the patient. This means going beyond the routine, please go see this patient and get me when you are done. Of course, it is helpful to provide some basic orientation to the workplace and the work tools they will be using. Orient them to the interview or examination room, the equipment they will be using, and the staff. Walk them through a patient's chart so they understand where to record or look up patient information. But more importantly, it is essential to orient the learner for the patient's encounter. Discuss what role and responsibilities the learner will have in your clinic. Is their role to assess new patients? Follow all patients? Who makes the management decision? Who will discuss them with the patient? Is the learner responsible for charting, dictating, ordering tests, checking on results? And what will you do? Be specific about how you like your learner to chart, present the patient case, or dictate. Learners need a sense of how much data to gather, record, and present. Do you want all the information about the patient or just relevant information? And don't forget to give the learner some guidance regarding their time management. Review your patient's schedule with the learner. Let them know how much time is reasonable to spend on what. Remember that every doctor's schedule can be quite different, so specific guidelines about how much time to spend taking the history, doing the examination, and or counseling the patients can be very helpful to the learner. Of course, it is helpful to select the right patient for your learner, a patient that can help and address the agreed upon educational goals for that clinic. Let patients know a learner is working with you in the clinic. Introducing the learner to the patient and providing some background to personalize the learner will facilitate the role of the learner in your clinic. For example, Mrs. Smith, I want to introduce you to Tom Smith. He is a third-year medical student who is helping me in the clinic today. Tom is from Prince George and is interested in family medicine. His job in the clinic will be to gather the information about why you are here today. Then we will do the physical examination together. Or, Mrs. Smith, I want to introduce you to Dr. Tom Smith. He is in his last year of training to become a gynecologist. He will be assessing you today, and then I will be joining you for the final discussion. Having a sign in your office will remind your patients that learners are in the clinic and can be helpful. The final step in preparing the learner is the most important step. For every patient, you want to consider what is the best way of involving the learner. Remember the learner's zone of proximal development. What is an important thing that the learner can get from this patient encounter? This means that you will focus the learner on applying their clinical skills to solving an aspect of the patient's problem. For example, let's say I'm seeing a patient who presents with chronic back pain. I may want to focus a medical student on taking a clear, complete pain history using the mnemonic PPQRST to guide their history taking. Conversely, for a senior learner, I may want to observe them perform a complete neurological examination. By focusing them on an aspect of the patient's problem, you will not get tempted to address the topic of chronic back pain, but rather focus your comments on that specific task you have assigned to the learner. Task-specific teaching is very helpful, especially for junior learners. You may direct the learner to part of the patient encounter, like examining the newborn, or you may even direct them to part of the counter, like listening to the heart and examining the abdomen or checking the reflexes. The learner does not need to see every patient, nor do they need to do all parts of the patient's encounter: history, physical, and counseling. It is often helpful to teach specific clinical skills, such as the examination of the cardiovascular system, over multiple patients. Remember, the patient that walks through the door serves as a curriculum for the day. Consider addressing an educational goal, such as assessing heart, assessing angina over multiple patient encounters. Maybe you and your learner decide to focus on assessing patients with respiratory complaints. The student then can see multiple patients with the same or different respiratory complaints. For each patient, you will assign a specific task. For example, this patient, I want you to take a history. The next patient, I want you to complete a respiratory exam. Each patient will present a unique challenge. Perhaps the first patient is a thin elderly woman with a wheeze, and the second patient is an overweight man with a cough. You can observe the learner perform their respiratory exam and then provide timely feedback on how to improve that exam, and then you follow that with another opportunity for them to practice that skill. Finally, avoid trying to teach the learner all about every patient's disease. Consider the take-home point that a patient's medical condition can help to demonstrate. For example, if I'm seeing a young pregnant woman with pain and bleeding in her first trimester, I will not try and teach all the possible causes for bleeding in the first trimester of pregnancy. I may choose the take-home point as it is important to rule out an ectopic pregnancy, which is a potentially life-threatening condition. I will focus on how we rule out an ectopic pregnancy. Perhaps we will just discuss how serum beta HCG rises during pregnancy and how we can use that value to differentiate between a normal or an abnormal pregnancy. Hopefully, by motivating them, by involving them in the care of this patient, it will motivate them to go home and read more around the topic of ectopic pregnancy. Avoid the temptation to lecture students and/or residents in the hallway about diseases by restricting your teaching to only in the presence of the patient. Ask the learner if they are comfortable presenting the case in front of the patient. If they say yes, immediately go to the patient's bedside. If there's any confusion about the student's history, you can then clarify details with the patient directly. Collaborate on the physical examination. Dr. Smith is going to listen to your heart, and then I will demonstrate how to palpate your peripheral pulses. Talk out loud when you examine or perform a procedure. Instead of explaining to the learner what test to order and why, explain to the patient what tests you ordered and why. Explain how you got to the diagnosis. This will help the learner. You can also teach the patient about their illness and teach the learner at the same time. So in summary, some important take-home time-saving tips include the fact that the learner does not need to see every patient, nor does the learner need to do all parts of the patient encounter. Remember, small steps can lead to big changes. So focus on specific aspects of the student's clinical performance. By improving those aspects over time, this will lead to big changes in their overall clinical performance. So today we discussed strategies to inspire and involve your learners. We have not yet talked about how to use questions to facilitate the diagnostic and therapeutic reasoning skills of our learners. There are specific teaching strategies that can be applied to the case presentation, like the 1-minute preceptor and snaps, and we will discuss these in more detail in our next in the series. For more information about how to teach in the clinical setting, I've listed a number of useful online resources. Please feel free to contact our UBC Office for Faculty Development and Educational Support for more information. I hope you join us next time for session number 3, Teaching Learners How to Think.